Assalamualaikum and good evening everyone. My name is Nur Fadiwa Bashira binti Selamat. Together with my partner Sofiatun Najah binti Mustafa Kamal, going to be presenting on the topic of the dengue epidemic in Malaysia. Now I'm going to let her explain more on the background of our topic. Next.
Okay, for the introduction, I will explain about dengue. What is dengue? Dengue is a viral infection that's spread by the bite of Aedes mosquitoes, especially Aedes aegypti, which is one of the types of Aedes. Dengue is one of the most common and serious issue in Malaysia that can give many effects or symptoms to the people like high fever, severe joint pain, and skin rashes. Next. For the credibility, we choose this topic, which is dengue, because dengue is a serious health problem that affects many Malaysians every year. By learning about it, we can increase the public awareness about dangers of dengue and we can understand how it affects the people's daily life. This topic also helps us to explore the social impacts of dengue and why prevention and early action are so important. Next. We move to the first chart, which is a bar graph that explains about dengue case incident and fatality rates in Malaysia from 2015 until 2021. By the way, this graph was taken from Frontiers in Genetics 2024, and the purpose of the graph is to identify the spread of dengue virus in Malaysia. From the graph, the x-axis shows the years and the y-axis shows the number of dengue case incidents. There are two more additional information which are the green line and the red line. The green line represents severe case and the red line represents fatal case. From the graph, we can see that the highest rates of dengue case was in 2015 and 2019, which has exceeded more than 350 cases per 100,000 population, while the lowest rate of dengue cases was in 2021, which not reached 100 cases per 100,000 population. So the dengue case increased during some years and after that declined sharply, which is in 2021. Next. To answer the purpose just now, which is to identify the spread of dengue virus in Malaysia, actually the article referred has explained about it. So firstly, in 2015, which shows the highest rate of dengue case, the spread of dengue virus in that year was due to the imported virus strains, which means the virus came and spread from the other countries. While in 2016 until 2019, the spread of dengue virus was due to interstate virus transmission and urbanization, especially in Selangor and Johor, which have a very high population density that can make it very easier for the mosquitoes to breed. And in 2020 until 2021, which shows the lowest rate of dengue case, this was due to the COVID-19 pandemic and the enforcement of Movement Control Order (MCO) that restrict and reduce the social and outdoor activities. So to summarize, human movement and environmental factors plays a big role in spread in dengue. Next.
Now I'm going to explain the chart 2, which is the bar graph, which was taken from the National Center for Biotechnology Information and CBI 2024. This graph shows the annual number of deaths and the mortality rate from 2012 to 2021. So before I explain the data, let me describe the bar graph briefly. So the bar graph displays the number of deaths which were represented by the green bars, and the blue line shows the mortality rate per 100,000 population. And the main purpose of this chart is to examine how the dengue mortality changed over time in Malaysia. And on the x-axis, we have the years from 2012 to 2021, and on the y-axis we have the mortality rate and the number of deaths. Now, next. Alright, now let's analyze the data. There are four main points that we can observe. Firstly, dengue deaths increased and reached the highest level in 2015 with the number of 325 deaths and the mortality rate of 1.09 per 100,000 population. This marks the most severe case in the 10-year period. Next, secondly, both the number of deaths and the mortality rate begin to decline steadily, showing that positive results from Malaysia's improved dengue control measures and clinical management. And third, in 2019, it began to rises again, proving that dengue incident can still re-emerge if the preventive actions are not maintained. And lastly, in 2021, the dengue mortality dropped to its lowest point with a number of 38 deaths. Um, and it was recorded nationwide, likely due to effective health campaigns and less exposure during the COVID-19 movement restrictions. Overall, we can see a clear pattern from the data, a sharp decline, a sharp increases and leading to a major peak in 2015, followed by a gradual decline and stabilization by 2021. Next. In conclusion, both charts show that dengue incidence in Malaysia is affected by people's movement and environment. We can clearly see that by 2015 to 2019, the number of deaths and the number of incidents of dengue are increased because of the travel and crowded areas. Overall, by 2015, it was recorded the highest number of deaths, and it was dropped to its lowest point with only 38 deaths by 2021, showing that awareness and clean surroundings can help stop the dengue. Alright, that's all from us. Thank you.
Thank you.